Welcome back to the IVT tutorial. We are discussing the indications of the IVT. We got already the indications in the field of rehabilitation. Today, we start to talk about the indications in the field of vascular disorders. What are the vascular disorders? There are the peripheral arterial occlusive disease, arterial disorders, so-called PAD, peripheral arterial disorders. Number one, we will talk about the venous congestions, chronic venous insufficiency, so-called CVI. We'll talk about the lymphatic congestions, the lymphedema, and we will talk about the lipedema and the combined lipedema. Maybe today we concentrate on the arterial disorders first of all. Arterial disorders, PAD means peripheral artery disease. That's the most common acronym for these diseases. But there are others as well. Some publications, some studies, they describe that synonym, that synonym as peripheral artery occlusive disease, PAOD, mostly common also in Germany. Others talk about the AOD, peripheral occlusive disease, mostly in the field of orthopedics rehabilitation or physiotherapists. They call it claudication, intermittence, not so often, but also uses CAD, chronic artery diseases. The physiological background of these arterial diseases is always the same. It's kind of an arteriosclerosis, other word as arteriosclerosis, sometimes written with an H, sometimes not. In any way, it means kind of a calcification, and it looks like that. There is the heart, there is the artery, and on the intima, or beyond the intima, there's the calcification taking place. Let's have a look to a video which shows this calcification. Quite nice. So we have a look to endothelial cells and the intima. The blood is flowing, and here it's narrowing and narrowing and narrowing, and soon it will be even blocked. You're gonna get this video as an attachment. So the typical cause of the disease is a healthy vessel allows that the blood can flow freely, easily, 7, 8, 9 meters per second. The narrowing means there are fatty calcium deposits and the deposition of blood clots, and they restrict the blood flow. The surrounding tissue is not sufficiently supplied with the blood. Finally, the blood supply is interrupted. For sure, the surrounding tissue can or will die. The calcification is a result of typical risk factors, one of them well known as smoking. Another one, the diabetes. 75% of the diabetics will die on heart attack or stroke. High blood pressure is a risk factor as well for the PAD. Also hyperlipidemia, elevated blood lipids. Obesity, finally, as well, and we all know that as well, a lack of exercise. But some people are suffering from a PAD and they will die on heart attack or stroke, although they do not smoke, they do not have diabetes, nor high blood pressure, nor hyperlipidemia, or they are not obese, and maybe they are even sports, doing gymnastics or fitness. But there are other risk factors as well. One is the age, we will see that soon, and an important one is also genetics. More than 20% of the PAD is caused by genetics. Gender plays also a role. There are more male than female affected with the PAD. In total, the incidence of PAD is between 4 and 13% of the total population. 4 and 13, anyway, it's a lot, but there's a huge interfield of that. It always depends on the studies and where the studies are done. The industrialized studies are becoming more and more affected by the PAD, not that much the not so industrialized countries. The elder we become, the higher the risk of PAD or PAD. Being elder than 70 years, 20% of the people, of the population, of the patients are suffering from that PAD. The outcome, I mentioned already, PAOD or PAD is an arterial disorder. It leads in any way to, in any case, to coronary heart disease. It's the reason of heart attack, it's the reason of stroke, and it's the #1 reason of death in industrialized countries. I will give you a compendium on peripheral artery disease. You'll get it via as a PDF, and it explains quite nice both the spread of PAOD and the prevalence. What we should know as well is that the PAOD causes the highest costs in any national healthcare system. It's not the cancer, nor the accidents, or nor corona. It's the PAD which produces the highest cost in the healthcare system. The PAD follows typically 4 stages, according to Fontaine. Fontaine was the one, that's the name, Fontaine. He developed these 4 stages. Stage 1, the patients do not feel any discomfort, but this stage can already be detected with the ABI. ABI means ankle brachial index. It's quite a simple test, like a blood pressure measurement. You measure the blood on both arms, brachial, and on the ankle, and then you compare the results. In this compendium, it's very nice explained, the ABI. ABI is also explained in A26. That's the study on IVT, on intermittent vacuum therapy, on diabetic macroangiopathy, done by the Heart and Diabetes Center, Bad Oeynhausen in Germany. I would recommend that one. Stage 2. Now the people feel pain. They feel pain while walking. If they start walking, they do not feel pain, and they walk, then they do feel pain, and that's why it's called claudication intermittence. This stage 2 is divided in 2 stages. Stage 2A, the people feel pain if they walk more than 200 but less than 900 meters. Stage 2B, the people feel pain even at a walking distance of less than 200 meters. Imagine what a discomfort in life. You walk and less than 200 meters, you need to stop because you cannot continue walking. You suffer the pain. Stage 3. In stage 3, the patients feel the pain also if they do not walk. this pain often occurs in the night, and then the people wake up, they bend their legs, they shake their legs, and that's why this stage is also often called restless legs syndrome. Restless legs syndrome is one aspect of a peripheral arterial disorder. It's not a neuropathy only. Stage 4 is the blockage. The tissue is damaged. It's called necrosis, gangrene, or it's also called a critical ischemia. Ischemia, there's no blood, critical, because it leads to amputation. Coming back to the studies, IVT. The studies show that the IVT can extend the pain-free walking distance. How can it do that? The study was done on elderly patients, and they all suffered the PAOD stage 2. And the treatment of the PAOD usually is a standard walking distance training, kind of gymnastics on a treadmill. And now those patients also got the IVT, and some patients only got the IVT and went not to the treadmill. What was the outcome? The effect of the IVT is stronger than the improvement caused by walking exercise and gymnastics. That's good news. Above that, the patients, they do not like the walking distance training because it hurts. The studies also show that the capillarization is increased. Okay, capillary vessels are blocked. The blood cannot flow anymore. What should be the outcome? The outcome of any training or also of IVT is we develop new blood vessels. We increase or provoke the capillary sprouting, collateral sprouting. That was a study you've seen already in sports, the Tyson study. It was a cooperation between university in England and in Australia. IVT is also effective in gangrene and critical ischemia, and it can avoid amputation. Have a look to the gangrene, that's how it looks like. And here is the case. A chronic critical ischemia, Fontaine state 4, and it shows the increase of the acra pulse during IVT treatment of the patient. The patient is a male and 61 years old. That was the beginning. Okay, there was pulse, but not real pulse. With 22 millibar minus or millimercury minus, we see how the pulse is going to increase. Here it's 24, it's increasing much more with 28, even more with 21 millimercury minus, even more, and with 43 millimercury minus, the pulse looks nearly normally. That's what IVT can do. Especially the effect of IVT on critical ischemia, diabetic foot syndrome, etc., was very well studied in the Heart and Diabetes Center, Heart and Diabetes Center in Germany. The effect of intermittent vacuum therapy on elderly patient with diabetic foot syndrome and critical ischemia. It was a poster on the Congress of the German Diabetes Association. The IVT also increases the ABI significantly. Also, there was a study, the A35 number of vacuum device of Weiergans. Regarding that ABI, I will try to show you something. That's an outcome of two studies. One of the German study, GET-ABI, German Epidemiological Trial on Ankle Brachial Index, and the study of the American Heart Association. Here is the timeline, the base years from 1 to 5 years, and here patient starts. Patients with a good IVE of 1, 1.1, or everything which is good, the number of 1 is quite good. They have standard life, patients will die, but on other reasons. But as soon as the ABI is lower than 1, the risk of death is increasing. ABI of 0.7, the risk of death is increasing. Like they say, event-free survival, it's the same. Let's have a look to the ABI of less than 0.5. It means within a time of 5 years, with an ABI of 0.5, patient will die. They will die of heart attack or stroke. So what the IVT can do, the IVT even can prolong the life, and for sure it increases the quality of life of the patients. Via that, IVT reduces the cost of healthcare drastically. This was the 2 days tutorial. You should be able to answer the following questions in regard of the arterial disorders. What is PAD? What does it mean? What are the reasons for the PAD? What are the stages of a PAD? How can a PAD become detected? And most important, what is the prevalence of PAD? What is the outcome of the PAD? You should be able to explain what is a critical ischemia and what is the outcome of IVT on PAD for the patients. What do the patients profit from if they get the IVT? You should also be able to answer the question how the PAD affects your national healthcare system, any healthcare system. And last but not least, what is the outcome of IVT on PAD for the healthcare system? That was the 2 days lecture on indications in the field of vascular disorders. We started with the arterial disorders because they are most prominent and important, especially regarding cost and loss of quality of life, and they lead to death. Please find the PDF and the abstracts in your WhatsApp or WeChat group. Thank you very much.